Visit the Merck Manual. Full access without fees or ads. Thousands of topics written by medical professionals.
Fever in adults. The quick facts. What is a fever? Fever is a body temperature higher than 100 degrees Fahrenheit. It's not just feeling hot or sweaty. Your temperature must be high, as measured by a thermometer. Most fevers in healthy people are caused by an infection from a virus and usually go away on their own in a few days. When you have a fever, your symptoms are mostly from what's causing the fever. A fever itself can't hurt you unless it goes higher than about 106 degrees Fahrenheit. Doctors try to find out what's causing the fever with a physical exam and sometimes a few tests. What causes fever in adults? The most common causes are infections. Less often, fever may be caused by cancer or inflammatory disorders such as rheumatoid arthritis. A fever of unknown origin, FUO, is a fever that is at least 101 degrees Fahrenheit, lasts for several weeks, and has no obvious cause that can be found by doctors. Doctors usually do many tests, including blood and urine tests and imaging tests, to look for an unusual infection or a cancer. If these test results are negative, doctors may need to test a sample of tissue, a biopsy, from your liver, bone marrow, or other area that may have an infection. What are the symptoms of fever in adults? Fever is a symptom of an illness and doesn't cause many symptoms, except, at the start, you may shiver all over and have chattering teeth, called chills. A high fever may make your skin feel hot to the touch. When the fever goes away, or breaks, you may sweat a lot. But you may also have symptoms of whatever caused your fever. When should I see a doctor about a fever? See a doctor right away if you have a fever or any of these warning signs. A change in thinking ability, such as confusion, a headache, stiff neck, or both, a rash, feeling faint or lightheaded, fast heart rate, shortness of breath or fast breathing, a temperature higher than 104 degrees Fahrenheit or less than 95 degrees Fahrenheit, recent travel to an area where a serious infectious disease, such as malaria, is common. If you don't have any of these warning signs, but you have a fever for more than 1 or 2 days, call your doctor. If your fever lasts more than 3 or 4 days, with or without any symptoms, visit your doctor. How do doctors treat fever in adults? Your doctor may not need to treat your fever. The fever means your body is fighting the infection. Your doctor will give you treatment for whatever is causing the fever. If the fever itself is making you uncomfortable, your doctor may give you medicines that will lower your fever. Drinking more fluids and wearing cool clothes may also help. If your fever is higher than 105.8 degrees Fahrenheit, you may need to be admitted to the hospital and given fluids by vein and cooling blankets.